Hello, everyone, and welcome to today's program, Living Your Best Without Distress. My name is Chelsea, and I am the Senior Director of Community Impact and Public Health for the National Kidney Foundation's Greater New York team. We are so excited to be hosting this program, and to everyone here tuning in, thank you for taking time out of your busy schedule to join us. Before we kick off the program, we have just a couple of quick housekeeping items. We'd like to ask that anyone who is joining from Zoom, please keep yourself on mute. We also encourage anyone listening today to answer questions. So if you are joining us from Zoom, feel free to submit your questions in the chat panel. And if you're joining us on Facebook, please feel free to submit your questions in the comments. And then at the end of the program, we will answer the questions during the Q&A section. Another housekeeping logistical item is for those who did register via Zoom, you received an attachment, a distress thermometer activity. We do ask that you have it in reference if you'd like to follow along when Mary discusses it. If you're joining on Facebook, you did not receive that email, but in the comment section pretty soon here, you will see an attachment with that thermometer. Again, it's not required by any means. You can just tune in and listen to the program, but if you do want to follow along with it, Mary will be referencing it at one point in the presentation. Again, thank you all so very much for being here. Tonight, we're going to be learning about many different topics related to CKD and mental health, including a description of the types and causes of distress, ways to increase emotional awareness, and strategies to work through and process emotional distress specific to CKD. And now, without further ado, I will introduce you tonight to our speakers, who we are so grateful to for being here. We have Dr. Mary Resit. Dr. Resit is a licensed clinical social worker who holds a master's and doctoral degree in social work. Dr. Resit began her career as a medical social worker and has worked in the areas of renal, oncology, neurology, and presently with the transplant and IBD populations. She is also a practicing psychotherapist in chronic illness, anxiety, depression, grief, and PTSD. Dr. Resit is a clinical assistant professor of psychiatry at the NYU Long Island School of Medicine, and additionally, she is the director of the Postmaster Certificate in Healthcare Social Work at the NYU Silver School of Social Work. Also joining us tonight is Shira Antonio. Shira Lee Antonio is a former dialysis patient with experience in peritoneal dialysis, both manual and the cycler machine. She was on dialysis after being diagnosed with end-stage renal disease, nephrotic syndrome, FSGS, for 5 years, and finally received her kidney transplant from a living donor on June 22nd, 2023. And information to current dialysis patients. Thank you so much, Mary and Shira, and I'll now turn it over to you.
Thank you so much. It's such an honor and a pleasure to be here with all of you. This is such an important topic, and one that I have felt really passionate about for many, many years. Living with this disease from the very beginning offers many, many challenges. And though I think all of you do such a wonderful job in just managing that, so many things come up that we're just not aware of that really affects us as far as our mental health, which then also affects our physical health. And so tonight, I just really hope that you can really just learn and just gain some strategies to really help you manage this disease and its treatment with much less distress. So on that note, we will begin. Technical difficulties here, I apologize. So I just want to mention that you are not alone in your experience. Everyone who goes through this disease will go through some sort of mental health challenge at some point. And certainly, dealing with this and then dealing with all of the other life stressors that we have, I'm sure at times can be very, very overwhelming. But I think, and it's something that possibly that we just don't share with other people. And it's something maybe, that we feel very private about, don't want other people to know. don't want to burden family. So then we live with this privately, which in itself can really cause distress. So it's really like putting up a front to hide what's going on inside. And just the research over the past couple of years have really shown us that our mental health, right, is really tied into our physical health. And when we start to feel this distress, whether we realize it or not, it can affect our physical health as well. So just something just to keep in mind, what we thought was really important to why we should have this talk today is things that we know that 33.3% of those who have end-stage renal disease will have mild to moderate distress, with 12.3 saying that it's really severe. And the distress has been found to impact us on our quality of life and our well-being. It often goes unrecognized and untreated. And when I worked in the renal world, so many people looked like they were just managing it really, really well. Though if they were to take one of these surveys that are required by the dialysis units, you would find that somebody is showing some sort of distress. And when maybe approached, you may not want to share it, but still there could be something going on. And is it really worth living with that silently? Can we start to try to become aware of what's going on, possibly starting to find that trusting person that we can share some of this with? It's known that medical outcomes are really better for those who manage their emotions. So this is the distress thermometer that we were mentioning. So just take a quick look at this and just look and see, is there something that you're feeling distressed about today? Could be, practical problems, emotional problems, spiritual concerns, family problems, maybe something that you're feeling physically. I'll give you just a couple of minutes just to look, a couple seconds to look at that. And you just want to rate yourself. Are you feeling a 10, very, very highly distressed? Or are you feeling maybe a 3 or a 4? Are there days and possibly days that you are at dialysis that you would feel more distress, right? But I think this is a really great gauge for us just to kind of check in on ourselves and really start to become self-aware about what's going on with us. I'll leave us here just for another minute. Shara, maybe you want to add right here have you found that you have been distressed on, has it changed over time? Some of the distress that you have felt. Has it gone up and down? Has it changed?
At times, yeah, I'm not gonna lie. Sometimes being planted, yeah, it goes up and down. The good thing was when I used to do dialysis, my nurse actually had a thermometer like this. They would actually on a monthly basis check in with us and ask how we were doing mentally, emotionally, physically. And even transplant, they still check in and they ask you. So at least they know that you go through these things. But sometimes you still feel, even as a transplant recipient, you still feel the stress.
Thank you. Thank you for that. So some of the causes that we find can cause some of our distress is something called infinite losses. And whenever we lose anything in our life, and obviously, we think of, certainly when we have a loss, we think of death, right? But we can have many, many different types of losses. And certainly a chronic disease is something that we acquire losses, right? Many different types. But what happens here is the loss is ongoing, right? When we have death, all right? We lose that person, we grieve, we go through bereavement, however long that may take. But at some point, we sort of move on with our life, right? And here, it's ongoing. And we'll talk about that a little bit further. But that's certainly something that can cause us distress, that grief never really ends. We can go through a change in identity, which can certainly be overwhelming and causes some distress. Who we were before, right? Our life has changed. So who we were before could be very different from who we think we are now. We could have a change in our narrative life, a story. You know, we all have this story in our head of these expectations of what our life is going to look like, of what we want to experience. We've all had goals, plans, relationships, you know, family like planning goals, many different things. And so right now, you know, that this illness could be changing some of that, causing distress. Maybe our support network, right, is not as supportive as we would like them to be, or not supporting us the way we would like to be supported. Medical trauma is a new term that's come out over the past year or two. When we go through we can experience medical trauma with any type of medical experience, could even just be visiting the doctor's office to experience medical trauma. But certainly when we're on hemodialysis, right, we experience that trauma, whether we realize it or not, in many different ways. Transplant surgery, just going through the surgery process, can cause us distress. And then while dealing with all of this because of our medical condition, we're now, you know, that's on top of our life stresses, our normal life stresses, family problems, financial problems. So, you know, one could understand at some point why things just feel so overwhelming and unbearable at times. So I want to talk a little bit about emotional self-awareness. So for us, I apologize. If I back up, I apologize. So for us to really start to begin to notice that we're in distress, we have to start to become aware of what we're feeling. And this is not typical of all of us. We don't go throughout our day, you know, wondering if I'm feeling sad. Some days we know that we're just feeling off. But do we really kind of stop and say, oh, I'm feeling sad, I'm feeling anxious, I'm feeling this. And so I think it's important to begin to recognize and understand, right, how our feelings are impacting our behavior, to really develop this self-awareness. Because what we think really, you know, leads to how we feel. It always starts with a thought, then it changes to how we feel, which really causes us to act that out in a certain way. So it's understanding how I feel and why I feel that way. So what's going on in my life today that's making me feel that way? Can I start to see how feelings are either helping me or they're hurting me? Right? We all have anxious times when our mind starts to ruminate and we get stuck on something. Oh, you know, I think, you know, she walked by me and he or she didn't talk to me and maybe there's something wrong. And our mind creates this whole story in our head. And these thoughts sometimes really end up hurting us rather than just helping us. And having this self-awareness can really give us an accurate sense of how other people see us. So to build the self-awareness, to start again, to really kind of ask, to take a pause. I tell people all the time to take a pause. So when we're starting to feel like, you know, we're heated, we're angry, we're upset, we're distressed, whatever, overwhelmed, anxious, to really kind of stop and take that pause and to kind of examine what I'm feeling right now. What may have happened to make me feel this way? And this is a practice. This is not something that's going to happen the first time out, the second time out. It may take a while before you really get yourself comfortable with this. And for those of us that may not, you know, that didn't come from background of like sharing emotions, this can be twice as hard. but something to do privately and maybe try to start to feel comfortable with. And then to really ask, is what we're feeling solving this problem that we're having, or this idea of what we think caused this feeling, or is it making it worse, right? So just, again, starting to practice, what I'm sort of feeling, what's making me feel this way. If I, get heated or angry, or, what's happening now? Just starting to question ourselves is a good way to start. So, Shira, did you want to add anything to that before I started getting into some self-help strategies for some of the things that cause us?
No, you could actually go for the self-help. I could help you with this one better.
Okay, great. So we will start with we're just talking about how we can process this grief and loss, how we can maybe recreate our identity or what that looks like now, build on our values, change our narrative life story. Cognitive reconstructing is trying to help us change those negative thoughts, which are causing feelings that aren't helping us, making us feel kind of sad, anxious, whatever it is. And then how we can start to maybe ask for support that we need, some of the things that we'll talk about. So to go back to the infinite loss, because I think it's a really important thing to discuss, it impacts our life forever, right? Once we have this diagnosis, it's a lifelong disease, whether we have transplant or not, right? Still have chronic kidney disease. And the closure of the grief is elusive, right? It's ongoing. And that's the difference between this kind of loss and anything else. It doesn't allow us to reach a place of acceptance, right? To move forward. So we have to kind of do this on our own. This is part of the work, I think, that we have to do for ourselves when we're struggling with living with this disease. That, we have to kind of get us to a place of, and acceptance may not be the right word, coming to terms with it, having the best life we can, living our life without distress, or as much as we can without distress. Because that grieving process doesn't give us that finish line, right? It doesn't allow us to kind of end it there. So we need to do that on our own. So one thing we can start to do to kind of look at the grief and loss, all these thoughts in our head constantly, and whether we're someone who, does have people who we share things with, we don't share everything, right? Maybe we even have a therapist, but maybe we're even not sharing everything with our mental health provider either. We may have close family and a support, but we still live with some of these thoughts in our head. And they could change from day to day. So I say to people, we need to address this loss. And sometimes the best way to do it, I'm not a person that will suggest journaling, but a good way of getting some things out of here so it doesn't sit in our head and cause a lot of rumination is to kind of write them down. It doesn't have to make sense. There's no grammar rules. No one has to see it, but to really look at what you have lost, write that down, right? What has this illness caused you to lose? What do you miss? What has been taken away or even robbed from you, if you feel that way? What does the lost objects mean to you? So whatever you lost, what does that mean to you, right? It's really important, I think, when we have this chronic disease, to talk about what this illness means. And from my experience, my work, even when I work with the medical students and other medical providers, when they want to know how to best help the patient from a emotional perspective, to really ask them what this illness means to them, because typically no one's asking that, right? We all want to know how to support them, but we're not asking what's really going on. And then on the other side of that, right, can we look at, despite the losses?
That's a thing I do a lot.
I'm sorry, go ahead, Shira.
Sorry, my signal is so bad. That's what we used to go through with dialysis as well. No one really asked how are you feeling? What are you going through? What are you experiencing? You just got spoke to. You know, this is what you have. This is how you're gonna live. You know, this is what's gonna happen the next 5 years, 6 years. You just spoken to, and no one listens. So it's important to find an outlet. Very, very important.
So yeah, so what you're saying is that you get told you have this disease, right? This is what you have to do. This is a treatment. So if I heard you clearly, it's important to really talk about this. It's important to get this out. Okay, great. And so despite the losses, so can we also look at what's been comforting to you? Right? Is there one thing to be grateful for during this? What have you come to appreciate maybe during this illness? And even in those even in these losses, what still remains an important value to you, right? Something to help you work through this. So just want to talk a little bit about the theory of narrative identity, because when we go through any kind of transition in our life, we're never the same person, right? And so the person you were before your chronic kidney disease, right, is different from the person that you are now. Even if you feel just as good, or life may be somewhat the same, if you were able to manage that out, you're still different. Any kind of transition we go to, we end up being different. So I think looking at who we were and who we are, right, really gives us an understanding of how we can make ourselves stronger, right? How we can make ourselves better, certainly living through this disease. So something to look at is who was the person I was before this disease, and what was important to me? Because I think sometimes, we tend to think, and we have had losses, and we tend to think that a life isn't the same, which it isn't. And so we lose sight of what's important, because now all these medical treatments and doctor's appointments and that becomes, I guess, a big part of your life. And so it takes like precedence over something that could be important to you. It's still important to you. Maybe we have lost that. Maybe we need to go back and kind of think of that again. I think it's very important, I say all the time, not to label yourself as a dialysis patient. I think as medical providers, sometimes we do that, right? We may say the dialysis patients, but on a personal level, you don't want to label yourself that. I'll talk about a little bit at the end about what we say to ourselves sticks. So be really careful with that. So you want to look at, right, who I was before, what was important to me, who I am now, and what's important to me. Well, what I think is still important to me. And how can I integrate the person that I was before and the person that I am now, right? Something to kind of work on. And I think what can help us, if we're not sure now of the values that, if we had before, if we still had them, or what's important to us now, what takes precedence now. Typically, when we go through a chronic illness, living with chronic illness, and even transplant surgery, we come out of this with a different perspective. So we're looking at our lives differently, for sure, right? And so what was important to me, last year prior may not be important to me now. And it's important to kind of take a look at that and to renumber our values and what's more important to me now, what things can I kind of put to the side. And that's one way of sort of recreating my identity. If I traveled before, okay, and I still want to travel now, can it be the same? Is that still the same importance to me as it was before, or is it something else that will be higher than that, or more important than that. Really something we should consider and think about to help us re-identify ourselves. I was going to ask Shira, I'm not sure if she's still having some technical difficulties, if she wanted to add to this. But also mapping out our life journey. So our narrative life journey has changed, right? The things, our expectations of what our life would look like is different. And again, there's losses in that, and we have to grieve that, right? We have to grieve those losses for sure. Can we, as we're recreating ourselves, we can recreate our life story, build this new narrative. Can we look at on a positive note, right? As much as you can. And I know it's challenging. Look at your life ahead and what picture do you want to see? What do you want to make of this life now, even though you're going to dialysis? What do you still have? What's important to you? What are your values? What drives you, right? What keeps you going, right? What purpose do you still that you feel that you, what purpose do you feel that you still have? So what kind of picture do you want to see of your life? Is there something that's important to you that you want to safeguard as you move forward? And what could that be? Something that you would never stop considering an important part of your life. How would you like to see yourself to be as you continue to, on this path of having dialysis or waiting for transplant or transplant recipient? And suppose there was an area of growth in the days ahead. Like, could you see yourself growing spiritually, emotionally, right? And what that might be. So different parts of our life path that may have changed, but that we can certainly bring back in with a different perspective. So I just want to talk a little bit about finding a mental anchor that grounds us, because we do ruminate, we do, get overwhelmed, feel anxious, whether it's anxious regarding our medical issues, treatment, or it's just life things that are causing us some distress or anxiety during this time. So the best way to really help us through this too, in the moment, is to find something that grounds us. Grounding techniques help interrupt the rumination in our mind. And though we may go back and we may go back thinking about what's ever causing us distress, but in that moment, we can interrupt it by using things with our 5 senses. It helps us keep us in the present moment. It reorients us to the here and now. And that's what you want to do, because we can't focus on something else. We can't be thinking and focusing on something else in the present moment. It just doesn't work. Our mind doesn't think that way. It helps us manage our overwhelming feelings or intense anxiety. And it helps us regain our mental focus as we're only in our head thinking, right? So there's 3 types, and I'll go through them quickly: a physical type of grounding, a mental type of grounding, a soothing type of grounding. And if you want to learn more about this, there's a ton of things on the internet that talks about grounding techniques and ways of just sort of helping us interrupt our ruminating mind, ease those feelings in the moment. And again, this is a practice. I hear all the time when I talk about this with the patients that come into our office, oh, it didn't work, I tried it. And I know it's frustrating. We want things to work, but it takes practice, because what we're doing here is really working on our sympathetic nervous system to try to calm that, because everything's heightened. It's our flight syndrome is just heightened. So this is a way of just calming that down. And the more we practice this, right, our mind's really, really flexible. And so it'll pick up on that much more quickly. Plus also, if we are feeling a little anxious or just stressed, we're not always going to be able to think of doing this, right? Because now we're just off thinking about this, feeling this way. And so if we start to practice this, at some point our logic brain will kick in and go, oh, you know what? I need to do something so that I get my mind off this. And I'm sure there may be plenty of things that you're doing now that you don't even realize that can help you just ground yourself and just calm yourself in that moment as much as you can. So some grounding objects, and they, if we're looking for something quickly, any object that's around you, right? We can hold it in our hand. What does it feel like? What is it made of? I have told medical students to keep things in their pockets. And if they're having, if they're feeling anxious about something, right, just keep something in their white coat. And so, and they could start to feel it and ground themselves if they're feeling anxious. What's the texture? Is it heavy or light? Does it feel cool or warm? So plenty of things that we have just sort of surrounding us at any point in time can help us just ground us. Could be a grounding object. So some physical grounding techniques is really the best thing that we can do is breathe, because we don't breathe well. We all breathe very, very shallow. So as to take those really deep breaths to help us ground ourselves. Maybe run cool or warm water over our hands and really be in the moment and feel that. How many of us are in the shower and we're never really feeling the water hit us, right? Is it cool? Is it warm? It's right where our mind is always going. So really being present in the moment and maybe feeling that. If we're sitting down, right, we can feel our feet on the floor, our hands on the chair, right? That's going to ground us, believe it or not. And really noticing that. So it's the notice. I tell people all the time, even when they're exercising, it's great that we do physical exercise, but someone who's running or walking outside, our mind is still spinning, right? So can we just bring ourselves in that moment, and we may have to keep bringing our mind back, and that's fine, to ground ourselves with listening to the birds or hearing our feet hit the ground, right? That's actually grounding. We can, try to relax our muscles, touch objects, stretching and focusing on the different sensations in our body. So different types of physical grounding techniques, something simple, but certainly tons of things that we could do, and lots of info on the internet. Just want to talk a little bit about breathing. It's really important to breathe just to help us kind of calm ourselves down when we're feeling distressed. Breathe in, hold it, breathe out, hold it. That square breathing, and to really just develop a habit of that. It does, even if we just take one deep breath, it really just helps us calm us down in that moment. Some mental grounding that we can try to do. If we're looking at our environment, I know people that have had trouble driving over bridges or maybe driving on the parkway, they'll say that they'll start to look at different cars, they'll look at the colors, they'll read people's license plates, numbers, or look at the different states, because they're trying to ease that anxiety, and so focusing on something else. Maybe we want to look at what's going on during our whole day and think about each activity that we're doing in that moment, counting backwards, naming objects around us, picturing a safe place and focusing on the details. So part of mental grounding is something called guided imagery. Maybe some of you have heard of that. And that really helps as well, but that's done in our mind, where we're really developing a mental picture of something that calms us. It can be helpful. Could be, something like the beach or mountains or safe place in your home, or smells even, when you walk into somebody's kitchen, maybe somebody's baking something and you still kind of smell those aromas. As a safe place. And you'd be surprised how our mind reacts to that pretty quickly. People that have gone through some surgery or different tests will sometimes try to picture themselves in this nice, safe place, so they're trying to be less anxious. So maybe somebody who's when you're waiting to be cannulated, you want to just maybe put yourself in that nice, calm place. of picturing yourself somewhere else. It may be hard in the beginning, but over time, it could be helpful. Name objects around you, say place, say the alphabet slowly, forwards or backwards, right? Because we're using our logic brain and our emotional brain and logic brain really run parallel to each other. They don't intersect. So when we're highly emotional, right, and highly anxious or ruminating or overwhelmed or feeling distressed, we can't pull up our thoughts. We just can't, right? So what this helps us do is really kind of lessen our emotional state and to kick in our like logic brain, right? Because I always say our like brain is on fire. And so we want to calm that down and try to think logically as much as we can. So doing some of these mental exercises can really stir that. So that maybe we can even look at our situation a little bit different, maybe after we go through some of these exercises also, that why am I worried about this so much, right? Maybe reading a sentence backwards. So I just want to talk about our beliefs and definitions and how they stick. So what we say to ourselves really matters. And so, I'll listen to people and I'll say, watch what you say, oh, this is that. And of course we're saying things that are a negative, right? But of course, we should be saying things that are like positive because they will also stick, but I'm talking about those negative thoughts, or things that we're saying even against ourselves. So our inner voice combines our conscious thoughts with beliefs and our biases, right? And they create an internal monologue throughout the day. So we don't even know this, but our mind is going, our thoughts are constantly going, right? And it's the most powerful influence on ourselves, right? Our inner critic, right? The messages we tell ourselves not only affect our thoughts, but leads to how we feel, how we how we behave. So you want to be really careful what you're saying about your disease, about treatment, about what this means to you, and we can, and I think as far as providers that support all of you, we understand how challenging that could be, right? And again, you need to recognize some of the struggles that you are having and how difficult it is. You need to recognize that, but at the same time, watch what you say because it sticks. Okay, and can we maybe ease up some of those words that we're saying to ourselves? We can start to challenge some of those negative thoughts by shifting the negative to the positive, but it takes intention and practice. Again, another thing, that takes practice. And I know this can be overwhelming as well, but you want to start small, right? With one of these things, you don't want to do all of these all at once. You want to start really small. Maybe by saying that I have got this instead of saying that I can't do this, right? Or, if we can't hear our inner voice, or if we can't remember the things that we're saying, if we sort of reflect and start to assess on what we're feeling and what's causing us to feel this way, we may want to write them down if we just can't always challenge the thought in our mind. It's sometimes difficult to do. Just write that thought down, right? And the first thing we need to do is screen that for whether it's really truth or whether it's not, right? My life will never be better again. What's the evidence for that? Aside from, looking at this disease, is there something else that you could bring in that could possibly make your life a little bit better? We wanted to try to identify the phrases that are distorted or inaccurate. That's why we want to challenge what we're thinking. What's the evidence towards that? So instead of saying, I will never do this again, I can try to do this again. Maybe I'll learn something next time, right? Maybe this is really difficult. I can't go through this treatment. Maybe there's one thing that I can find next time that will help me, that will soothe me during this treatment. I know it's tough. I'm not saying this is easy to do. Can we shift our perspective? Imagine what we say, can we look at how we would tell a friend what we're feeling, and thinking. Since, we don't give ourselves the same compassion that we give to other people. So can we just stop and say, okay, what would I tell my friend if he was going through the same experience? Can we apply that to ourselves? It can be difficult to give ourselves some grace, to find the words that affirm the wonderful person that you are and still are, and say them until you believe them, right? Write them down, put them on a Post-it, find a mantra that sticks, practice that mantra, say it before you go to sleep, say it when you get up in the morning, right? These small little things can certainly help over time. I want to talk a little bit about.
Hey, Mary.
Yes. Yes, Shira, go ahead.
So sorry. One thing, one of the things that you said in the previous slide, excuse me, was just finding ways of how to talk to people, and I would think to myself, what would I say to a fellow patient?
Mhm.
When I would go to my monthly visits, there was always 4 or 5 fellow patients that we got along with each other. We were on the journey together. And, they would always say, I'm tired. I don't want to do dialysis. I don't want to go through this anymore. And you would find yourself encouraging them, but putting yourself down. And I try to change it up a bit. I would be in those shoes, like, I don't want to do this anymore. I'm tired. I'm frustrated. It's tiring. It's annoying. And then I'm like, okay, but what would I tell, let's say, Pamela, when she was feeling this way? And I started changing my mentality, like, no, you're a fighter, you're a warrior. And I still tell myself that till this day. Like, I have a bracelet that says warrior, and whenever I feel a certain way, I wear it, and it changes your mentality. So you have to be very careful. Of your mind plays tricks. It's your worst enemy. It could be your best friends, but if you start thinking negatively, you're gonna live that life. So you have to change it up a bit.
Great, thank you for that, Shara. Are you getting what you need from your support system, right? And so I think, we have to tell people what we need. We have to, people are very, very helpful, can be very, very helpful. People mean well, they have our best interests, interest at heart for the most part. But sometimes we just really need to ask them what we need, right? That you just want to be listened to, that you just want to be validated, right? You're not looking for them to come in and fix it, which I think most people do, right? Because our family members and people that really care about us are concerned about us, right? If we're struggling, they can feel that. And so they just want us to step in and just sort of, fix that for us. And though they can't, so can you just tell them what you need? Is it a relationship that matters to you? So, are you choosing that person who really matters to you? But can you also accept the person that is helping you from their perspective? So even though they may be fortune telling or telling you that that you look great, or you're doing fine, or look at this, or oh, you feel better now since you're on dialysis than you did before, or you look better, or whatever the case may be, can we stop and look at that from their perspective? Difficult to do sometimes, and maybe understand what's driving them to say the things that they're saying that's maybe causing me a little bit distress. To look at who can provide our needs, right? We only need one person. If there's only one person that does that, and but does it the way that we need it, then that's a wonderful thing. And if there isn't, right, and that's okay, then maybe reaching out to some of the providers and great nurses, great doctors, great social workers that are in the unit that may be able to really give that to you as well. What are the barriers of, that you may have of asking someone to really give you the help that you need? And, can you see the advantages and disadvantages of asking for help? Can you see that difference? So when you're not reaching out, is it affecting you? And can you see that? So that maybe motivates you to sort of reach out for help. It's not always easy, and I get that. So I think just to kind of round this up, and then hopefully, there's questions that we can help you with, to develop the self-awareness of emotions and manage them rather than pushing them aside. To develop strategies that work for you. This is not one size fits all. So you have to find in any of the things that I spoke about, and this is just a very small piece of the things that we could do for ourselves. You have to find what's going to resonate with you. Okay. Finding that one person that can trust and be vulnerable with, reach out for support if it's too overwhelming. Certainly, you know, there are mental health providers. There is such a stigma when it comes to mental health. But I just want to mention that if you are being recommended to go to talk to someone, this is not long-term counseling. It's just to help you through this adjustment period and to help you develop some strategies. Many health systems have psychiatrists to assist as well. So thank you for your time tonight, and I hope you found some of this helpful.
Thank you so very much, Mary and Shira, and thank you to all of you for tuning in. I know we had some technical difficulties, so we apologize for that, and we appreciate you sticking with us. Thank you so much. We are now going to go through some of the questions that we've received, and if you're here on Zoom, please feel free to submit any questions in the chat. If you are visiting from Facebook, please feel free to put any questions in the comments. If we don't get to all the questions today, I will share my email address in the chat here on Zoom, and you can feel free to email me, and I will consult with Mary and Shira to get an answer for you and follow back up with you. So I will throw that in the chat, but I'm going to ask you a couple of questions. Mary and Shira, please feel free. I think we could hear you much better with your camera off, so please feel free to respond as well. Our first question we have is, you see all your friends get a transplant. How do you cope with the abandonment?
Shara, do you want to answer that first?
No, definitely. I mean, I had a perfect donor back in November of 2022. And, you know, I was noticing a few of the fellow patients that I was actually with during the journey, they were getting transplanted. Everything was going great. I finally get my donor. Unfortunately, she couldn't donate to me. At the very ends of, right at the finish line, we found out she couldn't be my donor. And it was like, okay, everybody's going through this. Why not me? When is it my time? And I just started changing it, just like you were saying, Mary, just changing the negative into a positive. It's going to happen to me. I guarantee it's going to happen. And I actually was manifesting, like, before my 40th, I'm going to get my transplant. It's going to be during the summer before, you know, while my children are on vacation for, you know, from school. I even bought a hospital bag shopping with my daughter. I'm like, I'm going to use this bag for my hospital stay. And everything was slowly coming into play. You can't be negative. You can't. It's frustrating. I'm not going to lie. You see so many other people, either they waited less than you. I waited 5 years. There was someone that was waiting for a year, a few months, and that was getting frustrating. But you have to be happy for the other person. You can't be negative. Just try to find your purpose during that journey. You're going through that journey for as long as it is. You're waiting for that transplant. You're not getting it, but find your purpose in the meantime.
So yes, I mean, you need to feel that abandonment, right? And it's painful for sure. But then I think, as Shira just mentioned, can you look at some purpose that you have now, some values that are important to you now that can just kind of hold you until your time comes, but certainly a challenging time.
Thank you, Mary and Shira. And then the next question, I think, is somewhat a bit in the same realm as far as, you know, embracing our feelings on things. But the next question is, you get a transplant, but it is slowly failing. How do you cope with returning to dialysis?
Shira, do you want to start, and then I'll just back it up?
That's a question that really gets to me, and I read it beforehand. I just actually hit a year post-transplant on Saturday, the 22nd. And I'm not gonna lie, I have FSGS, and as an adult, it can return. Your kidney can fail, unfortunately. And that's something I try to avoid. You know, I try not to think about it. I try not to think about going back on dialysis. So it's a scary world. I'm not gonna lie. I know someone actually that has had 3 transplants, and I ask them all the time, how do you cope with it? How do you manage? And no one has the right answer, because it's something you don't want to go through again.
But I think it's important to stay in the present moment as you possibly can. And it is, I mean, our mind's going to wander and the anxiety's there, and that's, I mean, that's valid. And your minds will certainly ruminate to that. But if you can focus on the present moment as much as you can, what you know now, right? What's happening now in this moment. And can you ground yourself, find one of those mental anchors if your mind starts to ruminate, and just practice that over and over and over, and see if that sort of helps you ground you in the present moment and try to deal with some of the anxiety and the stress of that.
Thank you both so much. And then our next question here is, how do you find someone to talk to who can help you post-transplant and takes insurance? And maybe alternatively, just to take it a little bit further, maybe for those who don't have insurance, if you'd have any recommendations around that.
Yeah, so so many of the transplant centers have psych assistants or psych departments, or they have peer like mentors. That's certainly, if it's just, if it's a peer mentor that you want to go to. But if you're looking specifically for mental health support, I would start to check with, if you're on insurance, certainly check with your health insurance first, see who's in your area. But start with your transplant social worker, see if they have psych within the health system. Going on Psychology Today, and sometimes looking up, someone who has some experience in chronic disease. It's challenging. I know it's challenging to find a mental health provider, but I think starting out with those people first and see if they have any recommendations. If you have, go on the Psychology Today web and just kind of look and search in your area, or start with your health insurance. Some companies also have EAP. So if you are working and you have an employee assistance program, you may want to start there because they give you a certain amount of sessions. So maybe that's an idea that you can reach out to, that you can, work with. It's tough. I get it. It's tough for sure. Maybe the NKF has, I don't know if you have any recommendations on what you tell people as far as mental health goes, but.
Actually, we have a support group. My friend Katja, who's down there somewhere, is the co-host. I was just going to put the info in the chat.
Great. And that's post transplant.
Anybody is welcome.
Yeah.
From
And
stage
also,
1 through dialysis through transplant, anybody with CKD.
Also TRIO is the transplant organization. I don't know what TRIO stands for. I couldn't tell you offhand. I'd have to look it up. But if you look at TRIO in your area, that's all transplant recipients. Certainly may be able to get some support from that.
Thank you so much, everyone. And thank you for everyone's input. We really appreciate that. Do we have any? I think that is our final question tonight. So if there were any other questions anyone would like to ask, please feel free to email me. I put my email address in the chat, and I can consult with Shira and Mary to get you some answers. We appreciate you all so very much for being here today. And Mary and Shira, thank you so much for speaking. There is a survey link that we will be emailing out to all of you afterwards. We would love your feedback on the program. We appreciate your support and commitment to NKF programs. Please be sure to check out our website for any programs moving forward. And thank you all so much.
Thank you. Take care.